Welcome back. You're watching Firecrackers, and of course we are live from our studios here in Lagos, Nigeria. Very, very sad development indeed. Prayers and thoughts are with the family of the departed. Well, just this year we have had to battle with Lassa fever. We've also had to battle with the COVID-19 pandemic, which ravaged nations all around the world. And now it appears that yellow fever is in some parts of Nigeria, as well as some strange illnesses have also been recorded in some parts of the country, with over 70 deaths, of course, tied to yellow fever in some parts of the country, as I mentioned earlier, including Delta and I think Kogi State. And so joining us live tonight is the Commissioner for Health in Cross River State, Dr. Betta Edu. She joins us live via Skype. Good afternoon, Doctor. Thank you so much for agreeing to speak with Galaxy TV.
Good afternoon, Kelly, and thank you for having me.
All right, it's always a delight to speak with you, Doctor. Let's see if we can get your take on all of this, which has played out since the start of September. Yellow fever in Nigeria. I mean, what exactly is going on?
Okay, so basically we are beginning to see a new wave of yellow fever in Nigeria. Unfortunately, a lot of lives have been lost. Before we could understand that it was yellow fever. Basically, we have started sensitization across for people to understand that they can get themselves protected from yellow fever if they take the vaccine. And it's also very important to prevent being bitten by the mosquito that transmits yellow fever. It's very important, the Aedes mosquito. So basically, there's an outbreak of yellow fever in different parts of the country, in Benue, in Delta, in Enugu, and several other states. And a lot of people don't understand how they can protect themselves from yellow fever. They don't even understand the signs and the symptoms of the yellow fever. Most times it presents like the normal malaria. You have headache, you have fever, of course, which is raised temperature. You have all the body pain, and then when it goes for 3 to 6 days, it in most cases will resolve. If it doesn't resolve, it's when it gets to the complicated state and it begins to affect the liver, leads to total breakdown of organs. The organs in your body begin to fail and can lead to death in extreme cases like we have seen in several states in Nigeria.
And then help us understand, is this disease, is it communicable? Is it also hereditary?
So it's not hereditary, but people who are infected, especially within the first 3 to 6 days, can infect other people when the mosquito which transmits this yellow fever beats them, pick up the infection, and then goes to the next person to bite that next person. So one of the things you need to do is to protect yourself, either using mosquito repellents and the rest of it. Wear long clothes that will cover yourself. Your environment, keep it clean. That's environmental sanitation is important. Personal sanitation is important, so that you can, of course, protect your area from being a breeding ground for this mosquito. So basically, it is transmitted by the Aedes mosquito from one person to another, from an infected person to another. If you can break that cycle of transmission, then you can protect others from coming down with the yellow fever. And you can break it also by taking your vaccines. People should get vaccinated.
And maybe I should also find out from you, do you think that in your capacity, probably the Nigerian government is even doing enough in terms of sensitization, especially at the rural areas?
Basically, I just think COVID has put a kind of blanket over everyone. So there's a lot of concentration by NCDC and indeed everyone to sensitize the public on COVID-19 and how they can prevent it. But very little is being done on yellow fever. But I'm happy that my colleagues in the states that are affected have already started sensitization at grassroots. In Cross River State, we have started sensitizing the grassroots. Our DSNOs, our community engagers are all out trying to ensure that people understand what yellow fever is, how they can report it if we have any signs or symptoms that's associated with it, and more importantly, how people should observe personal and environmental hygiene, as this would help prevent the yellow fever. People can also have access to yellow fever vaccine at primary health care facilities, general hospital facilities across the state.
All right, Doctor, let's
More
stray
still
away
needs
from
to be done, really.
and talk about something which is very much still a pandemic in most parts of the world, even though it appears that in Nigeria, the body language of most Nigerians is that we have probably defeated the COVID-19 pandemic. But is that what it is in your state? Is that what you see there?
So basically, there's a COVID fatigue all over the country. And well, not even just Nigeria, but all across the world. People are tired of carrying out the basic guidelines and protocols that have been put out to say use your face mask, wash your hands often, use hand sanitizers, avoid public places and public gatherings. As much as possible, try to observe social distancing. Very few people are adhering to that right now. As we go towards the festive period, it's getting worse because there are a lot of weddings, burials, occasions, left, right, and center. And you go there and you find people not adhering to these guidelines and protocols that have been given. But then we must strongly warn Nigerians that there can be a resurgence, a second wave of the COVID-19 pandemic in our country. So everyone must be alert and everyone must take responsibility to protect themselves at this point.
Well, Dr. Betta, I'll need you to stay with us for a moment. So we'll take a break. When we come back, we will talk a little about the possible second wave of the coronavirus in Nigeria and, of course, around the world, as well as the vaccine, which is trendy in most developed climes. That's in a moment. Stay with us. We'll be right back. Welcome back. You're watching Firecrackers, and of course we have live joining us via Skype Dr. Betta Edu. She's the Honorable Commissioner for Health in Cross River State. I need to also mention that she doubles as the chairperson of the Commissioner for Health Forum in Nigeria. Dr. Betta, thank you so much for staying with us on the program tonight. Well, resurgence of a possible second wave of the coronavirus. Let's even head on and speak about the vaccine, which in most developed countries, there have been news about progress being made with Pfizer and the BioNTech and all of that. But it appears that here in Nigeria, to be precise, and Africa, nothing is being said about vaccine.
Well, we're happy to know that there's a vaccine that has been produced, been manufactured, and it has been shown to have some 95% positive effect over the coronavirus, preventing the coronavirus. However, this is for patients above 65 years. We are yet to know what it is like for all the other age groups. But what is most important is the fact that we should not jump at the vaccine without carefully studying it in Nigeria and understanding the dynamics of that vaccine. Beyond even understanding the efficacy of the vaccine, it's also important to understudy our cold chain system. Are we able to protect this in the best of temperature from the point where it's being produced to the last end user in my village? Remember, like the one which is produced by Pfizer, it has to be kept in very, very low temperature to keep its potency and keep it viable, right? In Nigeria, how is that cold chain system? Are we able to transport it in that medium from the federal government where it comes in all the way to state, to local governments, to wards, and then to the end users in the villages? Do we have all the cold chain equipment, like the direct solar refrigerators and all the coolers that we need? A lot of things are required really to be able to maintain it at that temperature to the end user. Do we have it in Nigeria? These are the kind of things we need to consider. How many doses are we supposed to take to be able to get that protection from COVID-19? Remember, there are dynamics for each of these things. If it's a one-off shot, it's easier because you can get a lot of people to just take that one shot. But then what is the probability that the person who takes the first shot will come back for the second shot to be able to gain that protection against COVID-19, which will eventually give us the herd immunity and protect people in Nigeria? So there's a whole lot we need to understand about the COVID vaccine, and it's important for Nigeria to do its own research to understand the dynamics of the vaccine and how it will play out in our population. I don't think it's something we should jump at. It's a welcome idea, but I think a lot of work still needs to be done before it's sent out to the general population. What's most important is prevention, and Nigerians should understand that we can have a second wave, and so everyone should take responsibility for protecting themselves.
Dr. Betta Edu, always a delight to speak with you. We'd like to thank you so much for speaking with Galaxy TV.
Thank you for having me.
We're speaking with the Honorable Commissioner for Health in Cross River State, Dr. Betta Edu. She also doubles, incidentally, as the chairperson of the Commissioner for Health Forum in Nigeria. Now, still to come, we will look into the